Do you know how to protect yourself from getting bloodborne diseases? Do you know what potential diseases you may face if you come in contact with someone's blood or body fluids? Would you know what to do if somebody at your workplace got cut and blood was on the floor? The goal of the Pro Bloodborne course is to help you know how to answer these questions and give you the knowledge and skills necessary to prevent you from getting a disease from bloodborne pathogens. This course is intended for people who need OSHA-compliant bloodborne pathogens and infection control training, according to the OSHA 29 CFR 1910.1030 standard, as part of their job requirement because they may face occupational exposure to bloodborne pathogens and infectious disease. People who need this certification include healthcare providers, daycare providers, home care workers, teachers, tattoo artists, and general workplace employees. The Pro Bloodborne Training course follows the OSHA Bloodborne Pathogens Standard 29 CFR 1910.1030 and is required at the time of initial assignment to task where occupational exposure may take place. Annual training for all employees shall be provided within 1 year of their previous training. Employers shall provide additional training when changes such as modifications of tasks or procedures or institution of new tasks or procedures affect the employee's occupational exposure. The additional training may be limited to addressing the new exposure created. Pro Bloodborne includes the following bloodborne pathogens and infection control training. We cover basic terms related to bloodborne pathogens, how bloodborne pathogens and infectious diseases are spread, healthcare professionals' responsibilities to avoid spreading bloodborne pathogens and infectious diseases, HIV and AIDS, hepatitis B, C, and how to reduce risks of exposure, along with engineering controls, work practice to protect yourself, personal protective equipment, safe injection practices, skin diseases, exposure control plans, proper cleanup and decontamination procedures, hazardous disposal, and then the procedure to follow up if you are exposed to bloodborne pathogens through an incident. An opportunity for interactive questions and answers is available with Pro Trainings via email, chat, and phone support. So you might be asking yourself, how are bloodborne pathogens and infectious diseases spread? Well, first let's look at what a bloodborne pathogen is. It's a microorganism, such as a virus, that are present in human blood and can cause disease in humans. These pathogens include, but aren't limited to, hepatitis B, hepatitis C, and human immunodeficiency virus, otherwise known as HIV. Infectious disease is a disease that enters into the body through various routes that is caused by microorganisms such as bacteria, fungus, or a virus. And infectious diseases can range from mild to even life-threatening. For disease to be spread, it requires several conditions to be present that we call the chain of infection. There must be an adequate number of pathogens or disease-causing organisms. There should be a reservoir or a source that allows the pathogen to survive and multiply. In other words, blood itself. A mode of transmission from the source to the host, an entrance then through which the pathogen may enter the host, and lastly, the host has to be susceptible. In other words, they don't have an immunity to that virus or bacteria. Infection control strategies serve to prevent disease transmission by interrupting one or more links in that chain of infection. The primary source of potential bloodborne pathogens is blood and specific body fluids, like semen and vaginal secretions. Other bodily fluids may contain bloodborne pathogens, especially those visibly contaminated with blood, such as cerebral spinal fluid, which is usually found around the brain, synovial fluid, most often found around joints, pleural fluid, which lines the lungs, amniotic fluid that is in the uterus, pericardial fluid, which is around the heart, and peritoneal fluid, which is around the abdomen. Urine, feces, saliva, and some other body fluids do not typically carry bloodborne pathogens, but when introduced with blood, also become potentially infectious materials. However, it can be difficult to identify a body fluid or know for sure whether or not it is contaminated with blood. And in general, you should treat all body fluids as potentially contaminated with blood with the potential for carrying a bloodborne pathogens disease. So if we could be sure that we could always keep the bloodborne pathogen outside of our body, we really would never have to worry about this. But unfortunately, there's many routes that do introduce that disease into us. And the 4 basic modes are what we're going to discuss now. The first one is direct contact. This occurs when microorganisms are transferred from one infected person directly into another person. Examples of this would include a caregiver who has an open, uncovered wound and blood from a patient contacts the caregiver's wound. Parenteral exposure is this that comes in infected blood and then is introduced directly into your body through like a piercing wound, like maybe a needle stick or some type of sharp, jagged glass that has blood on it or metal and then jabs into your body. Indirect contact involves the transfer of an infectious agent through a contaminated object or person. An example would be a caregiver that doesn't wash his hands in between caring for someone with infected body fluids and other patients. Or a person picks up a blood-covered material with his bare hands while cleaning. And then airborne transmission, which occurs when droplets or small particles that contain an infectious agent remain effective over time and distance in the air, like tuberculosis, for instance. That's a very common disease that's spread this way. Bloodborne pathogens are not typically spread in this manner. You might be wondering what the most common way that bloodborne pathogens are spread. And it's most commonly spread through sexual contact. That's the primary mode of transmission for bloodborne pathogens. The highest potential risk while providing medical or first aid care exists when a contaminated sharp object cuts or punctures the skin. A parenteral exposure is what that's called. Now, examples would include like a needle stick, injection from drug usage, a cut from broken glass or metal, or human bites. A medium potential risk exists when an infected body fluid gets into an open cut or a mucous membrane, such as in the eyes, mouths, ears, or nose. The lowest potential risk is when a contaminated object touches inflamed skin, like acne or skin abrasions. In addition to knowing how bloodborne pathogens are spread, it's just as important to know how bloodborne pathogens are not spread. Intact skin is our first line of defense against disease, and bloodborne pathogens cannot soak through normal intact skin. The Centers for Disease Control, or the CDC, states that there is no known risk from exposure to intact skin. Unlike some infectious diseases, bloodborne pathogens are not spread by casual contact, such as handshaking, hugging, doorknobs, or using the same equipment, like toilets or water fountains. Now let's talk about HIV and AIDS. HIV, otherwise known as the human immunodeficiency virus, attacks the body's ability to protect itself against disease. HIV eventually will progress to AIDS, or the acquired immune deficiency syndrome. On average, within 10 years of HIV infection, this occurs. This time varies greatly from person to person and can depend on many factors, including a person's health status, behaviors, and the medications that they take. But since 1996, the introduction of powerful antiretroviral therapies has changed the natural progression of HIV infection to the development of AIDS. Approximately 1.1 million people in the U.S. are living with HIV infection. It's estimated that over 18% do not know they have it because they've not been tested and they don't have any symptoms. Approximately 50,000 people become infected with HIV every year, and about 15,000 people die every year in the U.S. from AIDS. Of the estimated 50,000 HIV infections diagnosed in 2011, among all adults and adolescents, approximately 62% of them were attributed to male-to-male sexual contact, and an additional 3% of diagnosed infections were attributed to male-to-male sexual contact and injection drug use. An estimated 18% of all diagnosed infections were attributed to heterosexual contact for females and 10% for males. An estimated 5% of all diagnosed infections were attributed to injection drug use for males and 3% for females. Less than 1% of diagnosed infections were attributed to other transmission categories. This less than 1% includes babies born to infected mothers, blood transfusions, hemophilia, sources such as needle sticks, and sources of which we cannot identify. To put the numbers in perspective of what causes the spread of HIV in the United States, out of the estimated total of 50,000 people each year that become infected with HIV, less than 1%, or around 51 cases, are actually related to other exposures like work-related incidences. So what am I trying to say? That out of all of the ways that we've discussed on how a person contracts HIV infection, very few will ever become infected or become sick from HIV due to a work-related incident, as long as proper infection control policies are followed. HIV is a deadly virus that causes AIDS. Symptoms, unfortunately, are unreliable and may or may not be present. A person can actually be infected with HIV or AIDS for many years and not even know they have it. Only proper testing can determine the infection. If symptoms were present, they could include fever, fatigue, night sweats, weight loss, rashes, or a dry cough. The HIV virus is fragile, fortunately, though, and it dies within seconds outside the body when it's exposed to air. The amount of HIV present in the body fluid and the conditions will determine how long the virus lives. HIV is primarily spread by sexual contact with an infected person or by sharing needles and/or syringes. Babies may become infected before or during birth or through breastfeeding. Only a fraction of the less than 1% of the people contract the virus from providing medical care, and that small number is mostly from needle sticks. HIV is not spread by casual contact like handshakes, hugging, doorknobs, or using the same equipment or toilets or water fountains, which is very good for us. There's no vaccine as of today, and there's no cure. Now let's take a closer look at hepatitis B. The hepatitis B virus reproduces in the liver, causing inflammation and possibly cirrhosis, liver failure, or liver cancer. When first infected, a person can develop an acute infection which can range in severity from a very mild illness with few or no symptoms to a serious condition requiring hospitalization. Acute hepatitis B refers to the first 6 months after someone is exposed to the hepatitis B virus. Now, some people are able to fight the infection and clear the virus. 90% or more of adults and older children who contract hepatitis B are likely to clear the virus from their systems within a few months and develop immunity. About 10% become chronic. The virus stays in their blood, infecting liver cells, damaging them over time and causing illness such as cirrhosis, liver failure, or liver cancer. Now, infants and young children are most at risk from chronic infections, complications, and death. Further, in most children, the virus is a silent killer. It destroys the liver or induces liver cancer, liver failure, or cirrhosis, often over a period of 20 years or more. It's estimated that up to 1.2 million people in the U.S. have chronic HBV infection. About 38,000 people per year become infected with HBV. Each year, about 3,000 people die as a result of liver disease caused by hepatitis B virus infection. Infections have significantly decreased since 1990 because of routine hepatitis B vaccination. Symptoms can be unreliable and may or may not be present. Only proper testing can determine the infection. Symptoms may include, but are not limited to, yellow skin, known as jaundice, yellowing of the eyes, tiredness, loss of appetite, nausea, dark-colored urine, joint pain, clay-colored stools, abdominal discomfort, and fever. Hepatitis B virus is up to 100 times easier to catch than HIV. This is because of several reasons, but for a couple, the virus is small compared to HIV, and also, HBV can live so long outside the body, at least 7 days, depending on the right conditions. It's mainly spread by sexual contact with an infected person or by sharing needles or syringes. It can also be spread from infected mother to her baby during birth or from contact with blood or body fluids through breaks in their skin, such as bites, cuts, or sores. People who are chronically infected can spread hepatitis B virus to others, even if they don't look or feel sick. However, like HIV, it's not spread by casual contact, such as handshakes, hugging, doorknobs, or using same equipment, or public things like toilets and water fountains, which is a real blessing for us. Unlike HIV or hepatitis C, there is a vaccine for hepatitis B. It's usually given in 3 doses, given over a period of 6 months. Hepatitis B vaccine is made from non-infectious material and cannot cause HBV infection. It's a safe vaccine where severe problems or allergic reactions are rare. Hepatitis B vaccine is 80 to 95% effective in providing protection against hepatitis B when the complete series of 3 doses of vaccine are administered. Now, it's wise to have your immunity confirmed through an antibody testing 1 to 2 months after your series. Booster doses of hepatitis B vaccine are not recommended at this time. The HBV vaccine must be offered free to employees who face occupational exposure to bloodborne pathogens. Employees who do not want the vaccine must complete a vaccine declination form. Occupationally exposed employees include those who give tattoos, piercings, or other body art, administer first aid, provide medical aid, assist in bathroom care, work in a medical or dental office, perform custodial duties involving the cleaning and decontamination of surfaces that may be contaminated with blood and/or other potentially infectious materials, and/or handle regulated medical waste. So in general, any people with jobs that expose them to human blood or other body fluids must be offered the hepatitis B vaccine free of charge. Now let's take a closer look at hepatitis C. The hepatitis C virus, otherwise known as HCV, reproduces in the liver, causing inflammation and possibly cirrhosis, liver failure, or liver cancer, much like the hepatitis B virus does. However, HCV is a different virus with its own traits. A person may be infected and have no signs or symptoms, and they can live with the virus for decades without even knowing it while the virus does damage to their liver. About 80% of the people exposed develop a chronic infection, and only about 20% are actually able to clear the virus by naturally building immunity. There are about 3.2 million people in the U.S. infected with HCV, with about 17,000 new cases yearly. Deaths from chronic disease each year total approximately 12,000. Symptoms are not reliable, and they're not a great way to detect HCV. You must have a proper test to be sure. Some of the symptoms include yellow or jaundiced skin, yellowing of the eyes, tiredness, loss of appetite, nausea, dark urine, joint pain, abdominal discomfort, sometimes severe, fever, and clay-colored stools. Unlike HIV or HBV, hepatitis C is spread primarily through contact with the blood of an infected person through needles. Hepatitis C is most commonly spread by tattoos or piercings performed with unsterilized equipment. The sharing of needles for injecting drug use, which is currently the most common means of HCV transmission in the United States. Receipt of donated blood, blood products, and organs, once a common means of transmission, but now are rare in the United States since blood screening became available in 1992. Birth to a hepatitis C infected mother, needle stick injuries in healthcare settings, although this is a low percentage of the HCV infection. HCV can also be spread less frequently through sexual intercourse with an HCV-infected person or sharing personal items contaminated with infectious blood, such as razors or a toothbrush. HIV-infected people face a much greater risk of infection of hepatitis C. There's no evidence of hepatitis C virus transmission from food handlers, teachers, or other service providers in the absence of actual blood-to-blood contact. Like HIV and hepatitis B, it's not spread by casual contact like handshaking, hugging, doorknobs, using the same equipment, or public items like toilets and water fountains. Traditionally, there's been no cure for hepatitis C virus. However, in recent years, new drugs have made big improvements in the way hepatitis C virus is treated. Some studies have had up to 90% of the infected people cured by taking a combination of new drugs approved by the FDA. The downside is that these drugs are very expensive and they cost tens of thousands of dollars for the required treatment. There is still no vaccine available for HCV. So let's take a closer look at skin diseases and disorders. Skin diseases, disorders, and conditions include persons with boils, infected wounds, open sores, abrasions, or weeping dermatological lesions. Any person with these conditions should avoid working where there is any likelihood at all that they could contaminate healthcare supplies, body art equipment, or working surfaces. Workers' skin should be free from rash or infection, and healthcare workers, tattoo artists, and caregivers should cover any sores with bandages to avoid the potential spread of disease. Skin is the largest organ of the body. It contains blood vessels, sensory receptors, nerves, and sweat glands. It's made up of several layers, and it varies in thickness from about 1.5 to 4 millimeters or more. Skin, remember, is the first line of defense against infection, as long as it's intact. Let's look at the layers. The epidermis, which is the thick outer layer of tissue, the dermis being the strong, flexible second layer of connective tissue, filled with blood vessels and nerves, and then thirdly, the hypodermis, which is just below the skin, and that's the more fatty layer, also called the subcutaneous layer. Commonly spread skin diseases include bacteria. Staphylococcus aureus is a bacteria commonly found on the skin and in the nose of some individuals. Most of the time, staph does not cause any major harm. These infections can look like pimples, boils, or other skin conditions, and most are able to be treated easily. MRSA, methicillin-resistant Staphylococcus aureus, infection can look like an ordinary skin wound, boil, or infected sore. However, the sore doesn't seem to heal, or it may even get worse. People contract MRSA by touching infected mucous membranes, skin, or contaminated objects. Now, in the community, most MRSA infections are limited to skin infections. More severe or potentially life-threatening MRSA infections occur most frequently among patients in healthcare settings with altered immune systems. A commonly spread skin disease that is a virus is herpes simplex. This is generally found on the face, scalp, arms, neck, and upper chest. It's usually indicated by small round blisters when broken, and they can secrete a clear or yellowish fluid. People contract herpes by touching infected saliva, mucous membranes, or skin. Some common skin diseases that are usually more of the fungus related are athlete's foot and ringworm. This infection causes red, patchy, flaky, itchy areas, and it's contagious, and it's easily spread from one person to another. It usually spreads when infected areas on another person or contaminated surface like showers, floors, and benches are touched. Affected areas need to be kept clean and dry. Some people with the following conditions are more prone to skin disorders, and that's people that have a history of hepatitis B or C, HIV or AIDS, diabetes, a history of hemophilia and or other blood disorder diseases, a history of skin diseases or skin lesions, a history of allergies or adverse reactions to pigments and dyes or latex, and have other immune disorders. Standard precautions are the minimum infection prevention practices that apply to working with all people. The key is to eliminate the exposure to all blood, bodily fluids, and other potentially infectious materials. Standard precautions includes the use of hand washing and appropriate personal protective equipment such as gloves, gowns, and masks whenever exposure to body fluids is anticipated. Now, remember, wearing gloves does not eliminate the necessity for hand washing. In fact, hand washing is the single most effective way to prevent infection. Hands should be washed before and after a contact is made with a client. Wash hands during procedures as hands become soiled. Wash hands with soap and water or use an alcohol-based hand rub immediately after removing your gloves. Follow your employer's exposure control plan. This is a written plan the employer must prepare to eliminate or minimize occupational exposures. Every workplace must have an easily accessible copy of its exposure control plan. The Bloodborne Pathogens Exposure Control Plan must include these things: a determination of an employee's exposure by job classification, the implementation of various methods of exposure control, including universal or standard precautions, engineering and work practice controls, personal protective equipment, information on the hepatitis B vaccination, communication of hazards to employees and training requirements, record keeping, procedures for evaluating circumstances surrounding exposure incidents, post-exposure evaluation and follow-up, and implementation methods for these elements. You see, the fundamental method of protecting against bloodborne pathogens and infection is by controlling hazards. This can be accomplished by elimination, which means getting rid of a hazard or hazardous task whenever possible. It can be also done by substitution, which means replacing a hazard or hazardous task with a safer equipment or method. And then engineering controls, which is using devices like sharps containers to block or eliminate the risk of getting stuck. And then personal protective equipment, otherwise known as PPE. Use it. Know where your personal protective equipment is and know how to use it properly. And then work practice and administrative controls. Following policies and procedures that eliminate the risk. These different steps will make your workplace and your work activities much, much safer. Now, I think it's important that we take a closer look at work practice, administrative, and engineering controls so that you understand them pretty well. Work practice controls reduce the likelihood of exposure by altering the way in which a task is performed. Now, administrative controls include following all the training, the legal requirements, the policies, and the procedures related to infection control at your facility. While engineering controls isolate or remove the bloodborne pathogens hazard from the workplace. These include things like sharps disposal containers, needle containment devices, and other safer devices for making sure you don't get poked or cut. Engineering controls shall be examined and or maintained, replaced on a regular schedule to ensure their effectiveness. An example of work practice administrative and engineering controls include the following: not eating, drinking, smoking, or applying cosmetics or handling contact lenses in work areas where there's a possibility of an exposure to bloodborne pathogens. When emptying trash containers, don't use your hands to compress the trash into the bag. Lift and carry the trash bag away from your body. All equipment and environmental and working surfaces shall be cleaned and decontaminated after contact with blood, body fluids, or other potentially infectious materials. If you're dealing with contaminated needles and other contaminated sharps, they shall not be bent, recapped, or removed. Needles and sharps need to be immediately or as soon as possible after use placed in an appropriate sharps container. Warning labels shall be affixed to the regulated waste and other containers used to store, transport, or ship other potentially infectious materials. These labels shall be fluorescent orange, red, or predominantly so, with lettering and symbols in a contrasting color. Use personal protective equipment. It must be provided by your employer at no cost to you. Examples include gloves. Use them when the potential exists of touching blood, body fluids, or other contaminated items. CPR shields and eye protection. Use these when the likelihood of splashes or secretions of blood or body fluid exists. Gowns. Use them when the potential exists of contact with blood or body fluid on clothing or exposed skin. Masks and respirators. Used to protect from potential airborne infectious diseases. Know where personal protective equipment is at your workplace. Know what personal protective equipment is available and how to use it. Make sure first aid kits and emergency supplies include disposable gloves and CPR face shields or rescue masks. Remember that if you're laundering items such as reusable gowns rather than disposing them, follow your facility's specific procedures for handling laundry. General laundry procedures include wearing personal protective equipment whenever handling the laundry, keeping contaminated laundry separate from other laundry, bagging potentially contaminated laundry where it is used, using leak-proof bags for wet laundry, transporting it in properly labeled bags, especially when shipping contaminated laundry to an off-site facility.